Hi.
I'm Dr. Jordan.
Oh, hi, Dr. Jordan.
How you doing
good.
today?
Mike Campbell.
Okay, Mr. Campbell. Thank you so much for coming in.
Sure.
So what brings you in today?
Well, I came in because I really need some help with my back pain.
Yeah. Tell me a little bit more about your back pain.
Sure. I mean, it goes back about 5 years. I was moving some furniture and some equipment into my home office, and man, I don't know. It was some kind of a file cabinet, and I was jockeying it around, and I felt and heard something pop in my back, and my God, I mean, it was just excruciating. I mean, I went right down on the floor, and just in horrible pain. I could barely move. So next day, I went to the walk-in, and I got a prescription for oxycodone, and it did a pretty effective job of relieving the pain. I mean, it didn't take it away, but it made it so that I could function. And I continued to use that. I was prescribed that for about 3 years, and my back pain never went away. I mean, it's just a chronic issue, but I was able to function, to work, and do a lot of the daily living things that anyone has to do. Then about 3 years ago, there was, I don't know, some kind of change in my insurance plan, and I had to start seeing a different doctor. Well, I go into this guy, and just giving him my history and my background, and he says, "Oh, we don't treat chronic back pain with opioids anymore."
Oh, goodness.
And I said, "Well, so what? What am I supposed to do?" So he said, "Well, we're going to taper you right off the oxycodone, and you'll manage the pain in another way." And I said, "Well, I mean, I need something for the pain." He said, "Well, it's not going to be oxycodone." So, number one, I started feeling miserably sick right away, and number two, my back is just the pain is off the charts. I can't function.
Wow.
So I'm not, I can't get a prescription.
So what'd you do? Yeah.
Well, I mean, I had to manage the pain somehow, and so well, look, I mean, it's not hard to find someplace where you can buy it. I mean, on the street, I knew a guy. I knew a guy who sold, and I started buying Oxy from him.
Okay.
I mean, I didn't feel like I was just trying to make up for what this doctor wouldn't give me anymore. I was managing my pain. I mean, I was not trying to get high off this stuff or anything, but I have a serious back problem. So, that went on for some time, and that's how I manage my pain.
Gotcha. So when you started to buy the oxycodone off the street, about how much were you using?
Oh, let me think. Well, when it first started, my original doctor put me on 20 milligrams a day, and that was funcking. But I mean, I guess your body must build up a tolerance to this stuff. So I was on like 80 milligrams
I see.
a day.
Yeah.
Yeah.
So had this back problem initially, was being treated by a doctor, and then the new doctor, because your insurance had to be changed, said, treated you like an addict almost, and just totally tapered you down and put you in a place where the only way that you were really able to relieve your pain, it sounds like, is going to get some oxycodone from the street. Am I?
Yeah.
Okay.
Yeah, he made me feel like I was some kind of an addict, and I mean, it's not the case. I mean, I've got a serious issue.